One of the things that I've learnt here, and it's been really, really fantastic to see, is that I'm one of 50 odd people and across 11 countries. And I think our problems in healthcare in terms of how we chart the patient-clinician relationship seem very universal, which, while that can be disappointing in one frame of reference, it is actually a great opportunity because it means that we don't have to just be country specific and local in the way we approach these challenges, but we can actually come together as a global force for change and for good. One of the key challenges, I think, for the patient-clinician relationship that doesn't get discussed enough is actually on the clinician side of things, just how challenging their environment is that they work in. You know, I don't know any doctors, any occupational therapists, any physiotherapists that become clinicians because they love paperwork and because they love administration. They don't. They become clinicians because they love people and they want to help people. And unfortunately, the systems, generically speaking, in healthcare that we give clinicians to work in actually do them a disservice in their ability to do their jobs. So one of the key things that I'm really interested in exploring here at Salzburg, and certainly what I do for a living, is actually looking at how can we give doctors and nurses and various types of clinicians better systems so that they can actually manage their workload better. And if we do that, then they're in a much better position to provide better patient care and to have more time to actually be with their patients and to be in a truly collaborative relationship with their patients. So one of the great examples that I've heard here at the Salzburg Global Seminar is from our colleagues in India. And they have been talking to me about the program that they have in India to train patients and to be advocates, not just for themselves, but for patients in general. And it sounds like they have a very comprehensive education and training program that is going to be reaching over 1 million different patients. And that's really exciting and something I think that we could look at a global level, how we could implement something similar. Some of the actions that I'd like to see come out of the Salzburg Global Seminar is for us to continue to work collaboratively at an international level. Because these problems that we're dealing with seem so universal, while we might have cultural and country-specific dimensions to them, at the core of them, the core of these issues, they're really similar. So I think if we can work together across countries to look at how we can improve and chart that patient-clinician relationship to get to a better place where patients and persons are really seen as being central to healthcare and not just in a lip service manner. Access in terms of transparency is only the beginning, and one of the things that we need to do a lot better is to actually enable patients to be on a more equal footing with clinicians. An example of that is how a path lab test result is shown. A bunch of numbers doesn't mean anything to anybody unless you're a clinician and you know what those numbers mean. And even for a clinician, it doesn't actually make sense to them in isolation. It needs to be in the context of the individual and the context of their situation and maybe their disease. So why can't we actually improve the way that we capture and communicate information that actually puts patients and clinicians on a more level playing field to interpret the information and to make it meaningful for patients? And I think we can do something really exciting with that.